Glioblastoma is the deadliest cancer that you can get. It's the most common type of brain tumor that you will have. And the outcome for glioblastoma is very poor. From the time of diagnosis, it's 18 to 20 months. What we would like to do is, of course, use the research that we do day to day to make an impact on the outcome of patients that suffer from a glioblastoma and increase survival. I'm Dr. Gelareh Zadeh. I'm the medical director for the Krembil Brain Institute. I'm the head of surgical oncology at the Princess Margaret Cancer Center and a senior scientist. I'm also a neurosurgeon at Toronto Western, and my practice focuses on tumor resection, and my research focuses on understanding the biology of brain tumors better. One of the most difficult elements of treating glioblastoma is that it affects the person that you are. It affects your personality, it affects your function, your arm movement, your leg movement, your speech, your memory. One of the challenges from surgical perspective is that at the time you present with a glioblastoma, there's a mass that you can resect by surgery. But beyond that mass, there are cells that have become invasive. They're similar to roots that go inside the brain, and it's almost impossible for us to chase those cells and resect them because it affects your brain function. Right now in our lab, we're focusing on being able to make discoveries that we can take into clinical practice as soon as possible. One way of being able to do that is to take existing drugs and repurpose them. We've done a study to look at how the cancer cells in a glioblastoma process sugar and be able to tackle that to cut off the sugar supply to the cells and as a consequence decrease the growth of the cancer cells. In doing that sort of a screen and the research that we've done, we've identified already existing compounds which are antimicrobials that allow us to be able to take that into practice for management and treatment of glioblastoma. Why do I do what I do? I think ultimately I have to say it's because I like to help my patients the best I can. In majority of the cases, as a neurosurgeon, where I remove the tumor, I can have a positive impact. I can remove the tumor, I can control from it coming back, I can improve the outcome of the individual. But there are a number of cases still, in particular, for example, glioblastoma, that my impact as a surgeon is limited. I can resect 80% to 90% of the tumor, but that additional component that's left behind is where the challenge is. And so when I think, why is it that I pursue to understand the tumor biology, it's really to be able to tackle the component that's left behind, that 10 to 20% that we can't help with surgery. And that's why we do the research that we do. We'd like to understand the biology of the tumor, why the cells came about in the first place, what makes them grow, and where can we intervene to stop the tumor cells from growing, from coming back, from recurring.